Good evening. I'd like to call the regular meeting of the Eureka Springs Hospital Commission to order on March 18th, 2024 at 6 p.m. Could I have a roll call, please?
Brian Byler.
David Carlisle, Commissioner.
Barbara Dix, Vice Chair.
Kent Turner, Chair.
Sandy Martin, Commissioner.
Angie Shaw, CEO.
Cynthia Asbury, CFO.
And we have Kate on the phone with us.
Present.
Thank
you all.
Thank you. You should have all gotten copies of the minutes, or well, you have copies of the minutes in front of you. I would entertain a motion to approve.
So moved.
Do I have a second?
I second it.
Any discussion or changes or additions? Hearing none, all those in favor say aye.
Aye.
All those opposed, same sign. Motion carries. I also sent out the agenda on Friday of last week, and I brought copies tonight for everybody. Do I have a motion to approve the agenda?
So moved.
Do I have a second?
Second.
Are there any changes or additions that need to be made to the agenda that anybody sees?
Are we going to talk about budget today?
No.
Okay.
Any other discussion? All those in favor say aye.
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 All those opposed, same sign. Motion carries. We do not have any members of the public here tonight, so we won't have any public comment. Committee reports. The reason we're not talking about the budget tonight, okay, and I'll just include this in the Finance Committee report,
Okay.
is everybody has been up to their ears in the Cerner conversion. I have talked to Cynthia about budgets, both operating and capital, but we really can't even start that until we get Cerner all done, and I think we're well on the way of having that. Hopefully we'll hear from them a little bit later. We, just so you know, finance meets every other week, and then administrative functions like IT meets on the weeks that finance doesn't meet. So we're staying on top of that. There's nobody wants them any worse than I do. We are getting a lot accomplished in the finance meetings and the administrative meetings both. So I think we're well on the way to getting things a little bit more organized from a finance standpoint. It's a lot of the discussion has been Cerner and technicalities of accounting. On the IT side, we've had some background work to do, which we talked a little bit about at the workshop. We now have lists of projects. I have asked them to prioritize those projects so that we can establish some focus and then and literally try to get things moving down. For a hospital as small as we are, we have way too many projects. Because that leads me to believe that we're not getting maintenance done, which we need to have done. So once we get the prioritized list, some of it I'm sure we will decide to outsource. Some of it we will do in-house. But anyway, we're going to start working down that list. We bought new, to give you an example, we bought new computers, and it's taken us forever to get those new laptops and new computers installed. And it's just because other things keep getting in the way. And so that's why in the IT shops that I've run in the past, we always had formal lists. We now have a formal process of how you get a project on that list. It's documented, signed off by people, and then consequently you can actually focus and work on stuff because you know what your priorities are and get it assigned. That's kind of it for the Finance Committee right now. Do you have anything on the public relations?
Marketing. Sam sent out her report with all the activities and everything. The one question I had on that, because I was unable to attend the town hall, how did that go?
I was unable to attend the town hall too. We'll hold that for a second, and okay. we'll have that reported because I want to report on that. If Angie doesn't cover it in her report,
Great.
We'll bring that back up. Because I'm afraid from a commissioner standpoint, there wasn't very many of us there. I will plead stupidity. I simply didn't get it on my calendar and I missed it. Otherwise, I would have been here. If it doesn't go on my calendar, I don't. It doesn't happen with me. So I've learned my lesson on that. That's the only two committees I think we have at this point. Hospital expansion update. One of our workshops very soon is going to talk about that because I'm really kind of waiting to see what KU comes up with because I do think, given the funds that are out there and knowing that we're not going to get much done in an election year, I think we're going to need to relook at the hospital expansion in total and literally, with the help of KU, maybe define exactly what it is we need. The 54 to 55 million was going to be a task anyway. Since we're still working with the state, that task might be harder, knowing full well that the state knows full well that the hospital doesn't have to be as large as we had it for a critical access hospital. So we're going to have to take a look at that, I think. Good. Angie, CEO report.
Okay. All right. So we'll start off with clinical operations. Our CNO, we've had multiple conversations regarding the upcoming eclipse that I reported back on February as well. So we're currently working on an action plan just to make sure that we have everything outlined and readily available resources if we should need them, whether that be staff on call or, making sure we have plenty of supplies. That's what we're looking at because it's still an unknown how that's going to affect us at this point, other than having an influx of visitors to the city. We are still currently searching for a full-time respiratory therapist. However, we do have 2 interviews. We had one Friday and we'll have another one this Thursday. So we're looking at getting that position filled. Physical therapy did move into the hospital. The space is working out well. We've been getting good reviews from the patients that have been coming in and using it. Of course, our maintenance team, Becky and Terry, they did focus on that space. They got it ready and did a great job doing it. One side effect that we did not take into consideration when we removed a wall was the echoing in there. So we're going to be looking at some sort of wall covering that might diminish that because it is very distracting, should we say. Dr. Nathan, the gastroenterologist that is leasing the clinic, she did see her first round of patients this past week, and she is scheduled to do procedures at the hospital in April. I think the second week of April is where we're looking at. Just to follow up, after our last workshop, I did reach out to our contact at the state regarding a baseline staffing requirement for an REH. He did respond to me on that day. That was back on the 4th. Said that he was going to research it and get back with us. I have not heard anything as of to date. I did reach back out just to follow up to see if he has any answers for us yet. As Kent said, Cerner was in-house training the last 2 weeks. The first week, March 4th, was more clinical focused. Last week was more of the financial back office focused. Each week definitely had their own challenges. That's why we do this training, is to make sure the system's getting ready for our go live. However, I do feel the financial training that was held last week, and Cynthia can contest to this too, is that it was very segmented and it was very frustrating to her and her staff. We did address this with our Cerner project manager, and there are going to be some areas of focus, I hope, moving forward. In both weeks, they did find that there were still a couple areas that weren't operating correctly, so they're focused on getting those up and ready and for our go live April 15th. And furthermore, each department is focused on training their staff, so that has been going on since March 4th as well, and just to get everybody ready for that transition. I know I reported back in February that I was attending the Maternal Health Roundtable panel. It was held in Little Rock. It was a great meeting. Everybody at state level is focused on women's health and the lack of very limited resources in rural communities. And to see that focus at the state level was refreshing. Speaking of women's health, that was one of the topics that was brought up during the REH roundtable on Thursday, and trying to figure out how those resources can come into our community for our women and children. And furthermore, the REH roundtable, like you said, it was Thursday night here at the Odd, or Thursday afternoon. We had around 8 to 10 people show up from community members. I kind of figured maybe the weather that day, was right when the storms were going to be hitting. Maybe that kind of delayed some folks attending. The group that did attend, they did ask pertinent questions, brought some different ideas to the table. And once I get those all written down, I will bring them back in. I think it was very well received, especially it's our first roundtable that we've ever had, and it was nice to have the community members come in and give us their thoughts.
What were some of their questions, just out of curiosity?
We had a gentleman that asked about if there was going to be any kind of, I wouldn't say almost like a grievance counseling, like for lost loved ones. It's more of a volunteer type entity more than anything, but those are things we need to hear. What is missing out there? I know that they have a couple of those, or at least one over in Berryville, so that might be something to look into. Women's health, of course, not just for OB and raising or obstetrics for babies, but just in general, all women's health was brought up. I had one gentleman question how we can be more involved in health in general, like promoting healthy walking or activities like that. So maybe partnering with the community center. And seems like those were the main ones. There was, it was brought up also to have like a community liaison that would come to our meetings and could be a community member at large.
Cool.
So,
Come to these
Yeah.
meetings.
yes.
Okay.
There's your seat.
We have plenty of seats.
Yeah.
Yeah, that's great.
And I know some facilities have kind of a task force like that, so it's something that we can definitely look into. But, yeah.
Well, sounds pretty positive.
Yeah.
There were no negative
So would you,
issues
Angie,
about
what
the
were there,
REH?
6, 7 people there? I mean, what kind of number came to the round table? What kind of guest number, 6, 7 people, or 3 or 4?
There were a total of around, what did I say, 8 to 10 total that came.
Okay. That's, for
And
this
then
area,
I
that's
think-
good
and-
representation.
And then I think 2 newspapers, so.
Oh, that's good.
And I know it was on YouTube. Sam said that I think it's had around 30-some views since Thursday. So maybe the ones that couldn't attend or didn't want to get out in the weather, they decided just to stay home and watch it.
Was it an older audience, or was it pretty well spread demographically?
I would say it was probably older. Yeah.
Thank you. It's encouraging.
Of course, Sam did have her marketing report. I did include a copy of that, and I know she's staying busy. I think the main thing was just to talk about the REH. She is going to go to Holiday Islands. Oh, gosh. They have a meeting tomorrow night that she's going to go discuss REH with them.
Good.
Don't fall off as you're talking.
Oh, yes, sorry. Sorry, I turned my face.
I
Is it
could-
the Rotary
The
up
city,
there?
city council, that's it,
City
Holly
council.
Island City Council meeting. I just lost all track of thought on what that was called.
Any questions for Angie? Thank you, Angie. Cynthia, you're on.
Okay, so the first page is going to be our bank account balances. I mean, the one thing to note is we didn't transfer anything from the commission's money market for the month of February. The hospital did, fully sustain on its own influx of money, and that does come from our CMS grant money, or inpatient revenue as well was counted into that. So that's on the bank account balances. Percentage change was only up about 1.5% by the end of the month based off the previous month. So the next page is our revenue and usage. For the month, it does look like it was up, but again, January was down. Overall, though, it is still down about 27% from last year for the month of February. Let me change papers, sorry. I knew that was not mine. We didn't have surgery in February because the way the surgeon schedule sometimes works, it's every 4 or 5 weeks. So we did have surgery in March, though. So you'll see a decline in our revenue usage for surgery. Lab overall was down significantly. In physical therapy, you will see an increase as far as in that number. Part of that is because we did update our charge code pricing for that based off of our charge master review. There wasn't but a handful of charges we did immediately update in MedHost, but that being one of our biggest driving factors. It was about a $60 per unit charge. So factored out through the month, it was a big billable revenue we felt important enough to change before we went live with Oracle. That's all I have on that page.
Question on that, Cynthia?
Yes.
Physical therapy almost doubled.
Yeah, that is because we did update. Like I said, the charge code was about $60 per billable unit. And a lot of patients see about 3 units is 45 minutes per visit. So when you factor that in, about $180 per patient was seen of an increase per patient per visit was in the billable revenue. That doesn't necessarily mean that's what our reimbursement would be, but that was kind of what we billed out the door. So that is why there would be, I think that was about the average, was $60 to $70 per charge code increase because they hadn't been updated since 2018. So,
Thank you.
you're welcome. The next page is our income statement for the month of February. And as to be, our outpatient revenue was down from the previous year. I would say the other thing is noting when we did record our CMS grant, our CMS inpatient is on there. It is under the other operating revenue about midway on the page. There is a few other things that hit with it because it's about $276,000 is what it was for the month of, that we would have received for February. So the other thing to note, is just down. We did have a loss for the month. Even with that calculated in, our loss was about $56,000 for the month of February. So.
And again, most of that's blamed on the fact the numbers, right? Just we're not seeing the numbers.
The numbers and then some of the expense stuff. So yes, our rent was down about 27% from the previous year. So yes, that's our overall volume's down. Lab was down and stuff. So it does. And not having surgery, for the month, that is about what we bill out in a month for surgery expenses. So I do take that into account.
Does that surgery usually happen every month, or is this something?
It's based off of the surgeon's schedule, so it's
Okay,
about every
okay.
4 to 5 weeks,
So
sometimes
it can
depending
carry
on
over into the next
Right.
month and not be, all right,
some holidays and things. It's just, we're
Okay.
thankful when he does come.
okay.
Yes. Usually he tries to make it every month.
The question about the new I can't apologize for my terminology of thought, not medical. How does this help us with our revenues and stuff with this new doctor? Is this a benefit, a positive benefit?
It will be. When she performs surgeries, we
Okay.
will be,
Yes.
it'll be similar to our current surgery
Okay.
setup with Dr. Bell. We will bill out for the surgery she performs in the OR, so.
Okay.
We are getting what would be minor, but we're getting rent from her too.
Yes, from the clinic as well.
Yeah, she's renting our facilities from us too.
Yes,
And will she be using our lab?
she may very well be,
Okay.
yes. Actually, I would imagine she would use our lab and our radiology as well.
Okay.
We have talked about it. We haven't set anything in stone, but
And then the next sheet is our balance sheet for the month of February. Just looking at our total assets and liabilities. So that's all in those reports. We did go live with our new financial system March 1st. It's been great. It does allow a lot more detailed in our reports. We've only been in it 2 weeks, lightly, I say, between all the other trainings, but it is definitely going to be a huge benefit. It's going to allow us to drill into a lot more of our expenses, where's our losses, where's our revenue, and really being able to run a lot of statistical data out of it. So it will be nice. Forvis will be on site the last week of April to the first week of May to do our 2023 financial audit as well, so.
Do we see Cerna as in the long run, basically putting more money back in our pocket? Does it, I mean,
I think it will.
I do
Well, first
think-
of all, it's less cost than what we're
Yes.
paying now.
Okay.
To Meadows, so
okay,
from that perspective.
first off, the lower cost operation,
Yeah.
all right.
I do think we'll see an increase in our charge capture revenue, of what we're
Okay.
billing out, what we're doing, being able to keep those prices up to date and it not being
Yeah, I like the
2018
218.
stuff. I mean, we can run down reports and look at when was, what is our old numbers, what does it look like? We
Okay.
have executable reports that we can actually use where we don't have that with our current system, and it's a matter of extracting it, putting it into an Excel, and then trying to filter it down from there, and so it will allow us a lot more. And some of that is auto-updated actually in the
So
Cerner
basically,
Oracle system,
You know,
actually.
with the movement to the RC, the positives of all this is that we're moving forward in some areas of capturing more profit or more money. I
Yes.
mean, that's what it all boils down to. We're bringing more into the revenue game.
Yes,
Yeah.
yes.
All right.
I got, back on the income statement, purchase services, why is it up so much in February? $144,000.
Which is,
And if you don't know, that's okay, I
A
understand.
lot of those would be from I think probably from our contract. I wouldn't say to look at previous year because some of that is not wasn't captured correctly, so that's where our ESS, any of our contract labor, our nursing and stuff like that
Okay,
is going to
okay,
hit.
okay.
Our IT stuff that we've outsourced, anytime we bring
Okay.
staff, essentially that is from there, that is where it should be captured.
so purchase services are all outsourced contracting that we're doing for
Yes.
service,
Yes.
IT,
Yes.
nurses,
Yes.
And
okay.
I'm assuming under Oracle, we're going to be able to get a lot more detail of what exactly that is.
Yes, yes, at any time we can click and be
Breakdown.
able to drill it down as far as like, you can roll it up to high level or you can drill it down to as detailed as you want and to be able to even see each invoice that hit on that specific line item. So that's stuff we can, in a finance meeting, be able to quickly at our fingertips look at and be able to execute, so.
Okay. Any other questions of Cynthia? I think she's given an Oracle, a financial and operating system update, but I will tell you one thing that has occurred that I think is wonderful. Our names are now printed on the checks, so all we do is get a check register emailed to us and approve the check register as opposed to having to go in every Thursday and sign checks.
That's improvement.
That makes it much easier. The next item on the agenda is reconsider the pharmacy system that we talked about last month, and I will explain that first. And then we'll need a motion to reconsider. When we looked at that at the finance meeting following the meeting here, when we meet here and then we meet on the finance meeting on Wednesday, it became clear that they were going to lease that equipment to us at zero interest. Because the lease payment that I saw, I thought was just the lease payment, but that actually included that $850 a month
Service contract.
maintenance contracts, okay? So from our perspective, if somebody's going to loan me money for nothing for 5 years,
Win-win.
in my opinion, we probably should do that. And then then the equipment goes away and we can make a decision about what we want to do 5 years from now, because it came out to less than $1,000 is what the premium was on it.
difference,
So that, to me, makes a whole lot more sense. So in order to keep our records all straight, we agreed to authorize the purchase of it. I'd like a motion to reconsider our decision from last month. If I could have a motion to
My motion.
Second?
okay? Anybody got any questions or any discussion? Okay, so we're,
So we still have a maintenance contract monthly we pay out for.
yeah, it was
Plus,
actually, when I did the rough calculation last month, I thought the $850 a month was in addition to what I was seeing as the lease payment. It was not. It was included in the lease. When we actually looked at the schedule at the finance meeting, it was actually included in that amount. So when you take that and simply multiply that by 60 months, it came out almost exactly to the amount we were going to purchase the equipment for.
yeah, including maintenance, that's, yeah.
Makes sense.
Hard to beat that, man.
Huh?
Hard
Yeah.
to beat that.
Yeah.
It's hard to beat that.
You really can't.
Accountants don't shy away from that kind of stuff very often at all. So we have a motion to reconsider. All those in favor of the motion to reconsider, say aye.
Aye.
Any opposed, same sign. Now I need a new motion to authorize us to lease the pharmacy equipment.
I make a motion to allow us to lease the pharmaceutical equipment.
I second that.
Okay? And just for clarification, that is for 60 months, okay? Any further discussion? All those in favor say aye.
Aye.
Any opposed, same sign. Motion carries. And do you have to pick your daughter up today?
No, I'm good.
Okay. Commission comments. Anybody got any comments?
All good. I'm encouraged by the roundtable. I think, the
Yeah.
more we can include the community is great, and I'm glad to hear that evidently, the communications are going out. They're being effective if there weren't any questions or anything else. So I think Sam's doing a good job in that.
The only comment I would add is if anybody in the community has questions, don't let them burn. Call the hospital and ask for Samantha Jones, and she'll get your questions answered. That's her job. That's what we need her to do. So we don't want people in the community worrying about things that they may not necessarily need to worry about. I will also say that on March 3rd, I was asked to come to the Holiday Island Community Church and give a presentation on the hospital. It was attended by approximately 60 people. It lasted for about 40 minutes. We had a very, very good discussion. There was anything negative that was said happened 5 or 6 years ago, which made it really nice for me.
Skated.
But there was one of the things that I found out at that meeting is a lot of people, because of those previous situations, were not willing to try the hospital again. I think of those 60 people, I think we changed the attitude, and I would say to the community that if you haven't tried us in the past 3 years, you need to give us a shot, because we are a much different facility, hospital, staff than we were 5 or 6 years ago. With that, we have our next workshop is on April 6th, 2024. We will continue to discuss staffing and issues that we discussed at the last meeting. Our next regular meeting is on April 15th, 2024 at 6 p.m. here. With that, I would entertain a motion to adjourn.
So moved.
Do I have a second? All those in favor say aye. Aye. We are adjourned at
Excellent.